I'm Dr. Jessica Kulick here at Family Focus Eye Care in Fond du Lac, Wisconsin, and today we're going to be talking all about cataracts. A cataract is when the natural lens inside your eye that starts out clear when you're an infant in most cases gets cloudy over time. It is not like a covering on the surface of the eye like most people think. I would say everyone is at risk for cataracts. Some people are born with cataracts. There's congenital cataracts. You can also get it from trauma. Certain medications or health conditions can also cause cataracts, and the most common cause would be aging. Preventing cataracts is typically done with sunglass wear. Wearing sunglasses can slow down cataract progression, but everyone will get them eventually if they live long enough. A cataract is removed by an ophthalmologist typically, where they'll make a small incision temporally on the cornea. They'll go into the eye and use something called phacoemulsification, which basically breaks up the natural lens inside your eye. When they break up that natural lens, they will suction it all out and put in an intraocular implant, which is actually just a piece of plastic that helps correct your vision. Dropless cataract surgery is done by surgeons who can actually inject all the medications in your eye at the time of surgery. When they inject the medications in your eye, it makes it a lot easier on you, so you don't have to take drops for the next couple of weeks to help prevent infection and promote healing and that kind of a thing. Our surgeon that we use typically does do dropless cataract surgery in most cases. Your health and medication list will determine if it will be for you or not. Recovery is pretty easy. Out of all the surgeries, it's one of the easiest ones. By the same day or the next day, you should be seeing decent enough to go about your daily life. There are some restrictions such as weight limits and that kind of a thing, but the surgeon will go over that with you. You do not have to patch your eye. You're not in the hospital. It's an outpatient procedure. It's relatively straightforward. A secondary cataract is when the back surface or the posterior capsule that holds the lens implant in place gets cloudy over time. It can happen weeks or years after the surgery, but you'll never need a full cataract surgery again. What you would basically do is actually go to a machine like this that has a laser attached, and you do it right in office, and you go zap, 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 and then you can see great again. Typically, we do never remove both cataracts on the same day, just because of risk of infection. Your eyes are very important, and if something were to go wrong, we would never want to lose vision in both eyes. Typically, we aim for either both eyes distance or both eyes breathing after cataract surgery. Not all patients are eligible for a multifocal implant. If you have a lot of astigmatism, you will not be able to. The surgeon will kind of go over your options once he sees your prescription and your actual eyes, but it might be nice to not have glasses for at least distance or reading, even if you just need readers or night driving glasses. Here at Family Focus Eye Care, we are all optometrists. We do not do cataract surgery at this location. We do have a few surgeons that we work pretty well with, so we can manage all of your post-operative care right here in our office. This has been all about cataract surgery. Cataract surgery is one of the most straightforward procedures that I think ophthalmologists do these days, because everyone gets cataracts at some point. I wouldn't be scared of it. It's a pretty easy procedure. If you have more questions, feel free to ask below or to call our office. We'd be happy to discuss it with you. Otherwise, stay tuned for more of our Ask the Doctor series that we're doing today.